afternoon. My name is Steve Hernandez, and I'm the Executive Director of the Legislature's Commission on Women, Children, Seniors, Equity, and Opportunity. We are here today for the next installment of an ongoing series, virtual town hall meetings that we have been holding with the Honorable Gary Winfield, State Senator. Today, we will be talking about universal exposure, disproportionate impact, the imperative of an equity response to pandemic and healthcare. I am joined today by some of the most respected names in the field of equity and health equity specifically. Firstly, we have Takesha Dawn Everett, Health Equity Solutions Executive Director, Wisdom Powell, Health Disparities Institute Director, and Molly Reese-Gavin of Connecticut Community Care. Welcome, everyone.
Thank you, Steve.
I have to say that this is a conversation that is a long time coming. And I think that at no other time have the disparities in health and disparities in access been ever more apparent than in time of pandemic. So I want to thank you firstly, Senator Winfield, for bringing this conversation to this format. And I'd like to start with you. We'd like to hear a little bit about your vision for this conversation and what it is that you've been thinking about regarding health and equity.
Thank you, Stephen. First, let me thank the Commission for being a partner in these conversations. I think these conversations have been really important for a lot of people who haven't heard the voices that are part of these conversations involved during the pandemic. When we were having the initial conversations, my mind went to a certain place. But I have to tell you, given the events of the last several days, I go back to the beginning of our conversation where I was saying that the issue that I'm going to sound like a broken record about how people are talking about a revelation of sorts that is happening and what's probably going to happen given that revelation. When you look at what has happened outside of the health sphere, just in this country with the police officer with his knee on the Black man who passed away, issues in Central Park, things that we have seen for a long time, I go back to that beginning point and say, we don't need a revelation. We have been seeing disparities for a long time. Given that, I think that it is important for the voices who are talking to be the voices of people who truly have done the work, people who have the experience, and people who connect to this in a way that sometimes the people who are talking don't. People who can talk about issues of physician bias, the translation, it has to happen in the medical sphere that other people don't have because they don't know that language barrier and what it means to change the story as the story is told. And so my vision is that we explore deeply conversations of that sort and then get to solutions, the strategies of how do we deal with this? How do we have a health justice approach that centers in the legal framework and the policy framework, the things that we're talking about. So that's my lens on this. And again, thank you to the Commission for making sure that this has happened.
Thank you, Senator. Thank you for that context. The beauty, I think, of thinking of this work intersectionally is that we have the opportunity to see how not one of these events and not one of these issues really exists in a vacuum. And the interrelatedness and the interconnectedness of these issues is really what we're talking about today. Dr. Wisdom Powell, one of the things that is remarkable, I think, about this pandemic is the disparities that have come to light. Disparities that I think so many of us knew about, talked about, but for one reason or another, whether it's political or practical, we haven't addressed wholeheartedly. Dr. Powell, what do you think is happening here?
So thank you for the question, and thank you, Senator, for inviting me to this important conversation. I think whenever we talk about issues of disparities, we sometimes can have what I call mission drift, where we get sort of burdened, if you will, by the differences, the relative differences in outcomes between groups. And while those are interesting and important to lift up, what's more important is advancing an agenda that creates an opportunity for every individual to have equal opportunity, equitable opportunity to live their fairest and healthiest life. And what is troubling to me is that in this conversation, what we're doing more so now is designing solutions really that focus primarily on behavior change as the center force for equitable action, when in fact, those policies and approaches will fail within fractured systems and settings. And so I think what's happening here is we're being called to action, to really put into practice the words we speak about wanting to have a fair and just system, about wanting to have fair and equitable access to healthcare. If there's ever a moment, a watershed moment that's been provided to us to demonstrate that we are walking the walk, the time is now.
Dr. Everett, just as a follow-up on that, there is oftentimes Dr. Powell refers to the admiration of data. We admire data in thinking about inequities. And sometimes the data leads us to the question of the chicken or the egg, which came first, the inequitable outcome or an inequitable situation. So can you speak to a little bit about what we're seeing in terms of inequity? What are the root causes of these inequities?
Thank you for that question. And again, thank you, Senator, for providing this forum for the discussion tonight. I am someone who subscribes to a basic response to this question. I don't think there are root causes. I think there is a root cause. And it starts and ends with the proliferation of racism in our community, in our society. And what racism then produced, which was a category of white and the production of whiteness. So what I mean by that is, this is no longer a question or a conversation about whether you or I like each other based on our skin color or based on the perceived notions of who we are and our heritage. It is a question or a conversation, rather, about the entrenched nature in which we built policies to actively produce the difference we are seeing unearthed in this pandemic. When we can just draw a historical line beginning in 1609, looking at the conversation of when the notion and a category of race starts in our society in the late 1600s, and then follow that line through the policies we then produced, the laws we passed, the structures we built to disenfranchise and unprivilege certain people in our community. The evolution of who that definition of those people are has changed over and over again. One standard is clear. Black folks have always been, Native American folks have always been the people who were the most impacted by these laws. But as time goes on, we move the ball, we move the game, and we change the definition of who we privilege and who we don't. So going back to your question, the heart of it for me is the system in which, through our laws and our actions, we privilege some people and we unprivilege others. And we follow that privilege along and through with how we invest in communities, what we don't provide in communities, and then we set up complete systems around that. Like all of our systems are built on that. One of the things, I won't get into it now, but all of our systems are then built upon who we advantage and who we don't.
I'm going to come back to systems because I think that's a really critical component of this conversation. But, as is typical, I think with our conversation, Senator Winfield, we jumped right into the meat of it. And Molly, can you help us think about and just give us examples of what these inequities look like on the ground, both pre-pandemic and now?
Yeah, I can. I'd be glad to, Steve. And Takesha, you've heard me talk about some of these folks before, I think. I want to use as an example a woman by the name of Mary, who lives in the North End of Hartford. She lives in a third floor walk-up apartment, third floor walk-up. She is 76 years old. She has hypertension, diabetes, congestive heart failure. The paint continues to literally peel off of the walls of her two-bedroom apartment. The building was built sometime in the early 1940s. I don't think the bathroom or the kitchen has ever been renovated. If you go downstairs, the garbage is piled up in 3 ancient garbage cans on the side of the house that have to be dragged out to the street. And living with Mary are the 2 loves of her life, her 2 grandsons. Their mom is in prison on a drug charge that I assure you, no white privileged kid from Avon, Connecticut would ever have ended up in prison over. But this mom is in prison, and grandmom is trying to raise those 2 kids. And the fact that she is not able to go to keep her medical appointments at the nearby clinic to treat her diabetes, to treat her hypertension. Of course she can't. She has the 3-floor walk up to deal with. She can barely get her mail every day if the kids don't remember to bring the mail upstairs. The lighting fixture in the hall in the apartment, the light bulb is out. It's been out for years. I mean, there's no light in there. So she has a difficult time navigating the stairs, not to mention the fact that, of course, she doesn't have any transportation to get to the clinic appointment. And this is the kind of a person that many people in society would dub as being non-compliant. I hate that term, non-compliant. She's not compliant with her doctor's visits. She's not compliant with her medication. She doesn't have transportation to be compliant with those things. The main goal of her life is everything that has to do with those 2 boys. And you want to know what's different now, Steve, in terms of the pandemic situation? One of the things that was critically important to Mary, I just can't emphasize this enough, was the summer programs for the boys when school left out. Now, obviously, we have the whole school complication now, but we also are seeing less and less opportunity for kids who need to be able to enjoy the outdoors, to participate in outdoor activities. These kids are not going to be able to do that this summer. And so we find a person like Mary unable to take care of her own health because the only thing she cares about is these boys. And she is extremely challenged in anything that has to do with teaching these kids or providing for their recreation during the summer because the system is not providing that. Steve, I won't go on and on. That's just one example that I'm sure everybody else can relate to. Mary is one person. There's no food store where Mary lives. There's no place for her to even do the regular food shopping. She can't buy diabetic appropriate foods if she can't get to a food store. So these are endemic social justice issues and challenges that as Wisdom said, these have to be, and as Gary said, these have to be addressed on a systemic level. This isn't Mary's fault. This isn't Mary's daughter's fault. This is a systemic challenge that the pandemic has laid bare in a way that it hadn't been before.
Thank you so much, Molly. Senator Winfield, the story is one that is told to be emblematic, but I wonder how many of our listeners on Facebook Live and CTN hear that and think, that's my grandmother, or that's my mom, or that's my sister, or those are my kids. So I wonder if you could reflect a bit on that.
Yeah, I often when we're having these conversations, I think it's important to paint that picture that not everyone sees. But I have to admit, I struggle a little bit because I think this is deeper than even those things which you may be able to paint the picture. I think if you're a Black woman of some means and you go into a hospital, you're still not getting equal outcomes, right? So
Right.
This goes back to what Takesha was talking about as the root cause, right? Because we often want to talk about root causes. And I know that there's some organizations that have laid out strategies to deal with this, and as one of the strategies is to deal with the root causes. But I think unless you name racism as the root cause and you go back and begin to do the work of disassembling the structures that have built themselves upon that racist root, then you're never going to make advancements. And so I guess as I reflect upon what Molly was just saying, I say, yes, we must talk about those things. But if we're going to have a deep conversation, people must know that those studies that we saw in the last few years about Black women going in and having babies and having disparate outcomes, saying this is what's going on with my body and not being listened to because they are Black, are part of this whole thing. And it gets to how if that is the response that I'm getting from the healthcare system, even when I have privilege, then how can I engage with the healthcare system? How am I able to hear when people are telling me you must do X, Y, or Z, right? Who are the people? If we're talking about the structure, there are people who exist outside of the structure that have to be brought into the structure to become messengers back to the community because they have trust, and those communities can no longer trust the system as it exists. And so as we explore this conversation, I want us to bring that in too, because I think it's important for the audience to know that, yes, there are many people who are impoverished and don't have access, but there are people who have some access who still are getting a disparate outcome from the system as it currently exists. And that goes back to the root of racism.
Absolutely. Absolutely.
Dr. Powell, thank you, Senator. Dr. Powell, a dear colleague of mine in this work reminded me this morning of the kindness movement around this work. And the question that often comes up to what Senator Winfield was just describing is, why are you being divisive? Why can't we just be kinder to each other? Why does this all have to be about racism? What's your response to that, Dr. Powell?
So I always respond to comments like that by reminding folks that racism is deeply entrenched in the soil, the fiber, the wiring of our nation. If you think of it like a house, right? When you build a house, and if there's a problem with the plumbing, a problem in the wiring, a problem in the foundation, then the house can't stand. And racism is like that. It is in the walls, it's in the paint, it's in the floorboards of it's with us, right? It operates like carbon monoxide. It's difficult to detect sometimes, although in current times and recent times where it's not so difficult to detect. But it operates in ways that sometimes are insidious, such as in physician care or patient-physician relationships. What I've learned over the more than 20 years that I've been working in this space and doing both research and advocacy around mistrust and health system processes and racism in healthcare is that racism that you experience in your everyday life gets carried over into health settings. Physicians, healthcare providers are human beings who are living in a racialized context. So the idea that they would be able to come into a health system and be totally immune to the racism that we're all breathing in is a misnomer. And for us to avoid the necessary conversations around that would be a tantamount to creating medical harm. And so we have to be willing to have the conversations. Look, folk who are impacted by racism are tired of talking about racism too. So don't think that folks wake up in this space like just ready and armed to talk about racism. We actually would love for the conversation to end and for us to get on to the work of building a better democracy where everyone can have free and equitable access to resources. But that's just not where we are. And so an honest conversation that's not about me having more Black friends or you having more white friends, which is really about how do we fix the nature of our democracy so that we reduce the opportunities for injustice. We have to be just as vigilant about protecting ourselves from difficult conversations, use that same vigilance that we use around that with pushing people to have the conversations necessary to dismantle and disrupt racism. It is not going to happen organically. We've been waiting for that since my dear colleague Takesha laid out the timeline. We've been waiting. It's not going to happen. So we have to act in a way as citizens that protects our democracy. And to me, there's nothing more like American than fighting for injustice. Like this country was built on that. So I think that for us to move the needle on those issues, it's going to require not just allyship in the way that we think about it. We like to think about it, me just sort of taking your side and making you feel better about being Black or brown, but actually leveraging your privilege. And recognizing that if you're in a position of power and authority to make a decision that will create a more equitable system or settings, then you should do that. That is the way you demonstrate allyship, and that's the way forward for reducing structural racism. And it won't happen unless everyone joins together and leverages their privilege in that way.
Dr. Everett, thank you so much, Dr. Powell. Dr. Everett, we know that if, as a student of history and a student of civics, we know that enfranchisement in this democracy and in this civic infrastructure has been a gradual process with only certain white men of privilege, white Anglo-Saxon Protestants of privilege being part of the originally enfranchised people in the country. The franchise has expanded over the years. Are we there yet?
Absolutely not. I mean, so let's just take a step back for a second and make sure that we're all on the same page for the listeners. When we're talking about franchise and disenfranchisement, the history, we're currently in my organization doing a 21-day racial equity habit challenge. And the first document we read was centered on how whiteness was developed. And what people tend to forget historically is the only people who had the right to vote were rich Anglo-Saxon aristocrats. That was it. Women couldn't vote. Property owners, Black property owners, selectively, depending on where they were, could because they own property. But eventually, as we began to build this chasm of whiteness, this category of indentured servitude separating the Blacks who own property from the whites who were once indentured, so too went that right to vote. And when you talk about, are we there yet? Let's look at the historical attempts to take away one's civic basic right to vote and decide who represents them at a federal, state, or local level. The conversations that have been happening right now during the pandemic about whether or not we can do universal absentee balloting, whether we can or cannot mail these things to people's homes to ensure that they feel comfortable in exercising their right to vote. What happened in Wisconsin, these are just mere attempts letting us know that at every turn, no matter how much, as Senator Winfield mentioned, even those of us who have privilege, no matter how far we've gotten from slavery, no matter how far we've gotten from our sharecropper grandparents or parents, we are still Black in America. And at any time, our ability, our right, our desire to vote can be taken away from us or put barriers in front of us. And I'm having a conversation today. I want to be very transparent. I am an African-American woman, and every day I wake up and I go to sleep as one. But the last 24 to 48 hours have made it very clear to me, we need to name and talk about with real language who and how we are disenfranchised in this country. Blacks, Native Americans, Latinos, Asians. It is an attack and an affront on all people of color. And it is all about your proximity to Blackness. No, this is not a dichotomy between Black and white. I'm going to be very clear about that. That's not what this is about. But when you read the history and understand how we built these categories, it is a proximity to Blackness that disenfranchises all of people of color. So I just want to make that clear when I'm making my statements right now, talking about Black Americans, what has happened in the last couple of hours and what continues to happen every 365 days I breathe. I'm feeling that really clearly right now, but we all suffer in this conversation when we are not very clear about the lives that are being lost, the advantages and privileges and rights that are being taken away from people simply based on the notion of racism. I also want to just add really quickly at the end of this, are we there yet? We are so far from there, when we unpack the data and look at the numbers of who is dying and who's being infected by COVID-19, it lets you know we are not there yet. When we look at what happened in New York Central Park from a Black man who is watching, who's bird watching, and the weaponization of whiteness in a cell phone, we are not there yet. When we look at what is happening right now as we are having this discussion, CNN keeps popping up on my phone because of the eruptions of protests that are happening in Minneapolis. No, we are not there yet. And I too, like Dr. Powell, I'm tired. I would love to wake up tomorrow and we are not having a conversation that's rooted in difference and entrenched institutionalized racism. I would love to wake up tomorrow and be able to look at my goddaughter and say to her, we no longer need to have a talk with you about how hard it's going to be for you to succeed and be healthy and be happy in America, but rather you are going to win based on your own merits of who you are and the work that you put in. That's the conversation I would like to have, but honestly, today it's not the one we have. So no, Steve, we are not there yet.
Senator Winfield, our viewers on Facebook Live and on CTN may be wondering, I thought we were talking about health equity. How are these things connected?
Yeah, I think when you talk about any of the issues that relate to that root that Takesha was talking about, you have to recognize that they all touch upon one another. I'll give you an example of just what I'm observing, and I brought this up on the last call we had. In the middle of this pandemic, oftentimes you don't see Black people at the forefront of what we're doing. And in this state, we had the good fortune in some ways of having a Black person leading the public health conversation. Well, we know that's not what's going on currently. And so I think it's important for people to recognize that race always has a role to play here. If you look at what happened in that situation, regardless of what the backstory was, to understand the history of race in this country and to make that decision in the middle of this pandemic it's crazy. It's crazy. What it does is it says to the community, particularly when you don't fill in those gaps, right? It says to the community, we don't need you to lead, but we can bring a white person in and they can do multiple jobs when this Black woman couldn't do the job. Right. And so there are racial implications for everything we do because race is touched on everything we do. And you see our leaders, right, because people often, to go to the point that Takesha was bringing up about what we've seen in the last 24 to 48 hours, people are often talking about the people on the wrong end of these things. But you even see our leaders being defenestrated in public. Right. So like last year when we had the police accountability bill, which is a different subject, but when we had the police accountability bill, and I chose to walk out a little further than people normally walk out, you saw a response from a national police organization in public that said that, and I'm going to use the word because I don't shy away from it, that nigger needs to be put back in chains and dragged back to slavery, right? So whenever we step forward to say, look, these things are happening, these are real things, there are people who step forward to say, even your leadership is going to be removed. Even your leadership is going to be disempowered. And one of the things I think is important for people to recognize about these conversations is these conversations have to become conversations not only about our appeal to government, but the power we have in government and understanding we need to take power in government, not shy away from that not getting there and saying, well, I have a role as this title that I'm given, but being the person at the top who makes the decision, being the group of people who are operating together so that they can make the decisions. Because the honest truth is we have watched people watch us drown in this country. We have watched studies go on when we had the H1N1 flu pandemic. We saw the same things happen. There was a study done in 2009 that said the exact same things we're seeing now. No one should be asking themselves, oh my goodness, how did this happen? Let's go do some study. We know every pandemic we have had, we've seen a disparate impact on people of color, specifically Black people. And yet we sit here again asking the same questions, talking about the same things. The reality is we have not had the power to make the change happen, and we have to change course and make that one of the goals that we have.
Thank you, Senator. You know, Molly, for so long, we have grown accustomed to hearing people of color being described as lacking resilience, as lacking the will, as you described with your example of Mary, the will to be engaged in their own healthcare or their own success. This pandemic has made it very clear in the past few months that what really is at stake here is the resilience of the state and the resilience of every infrastructure on the state that relies upon its population. So can you tell me a little bit about what you have seen in terms of the resilience of the very system that is supposed to be helping people who are impacted by poverty or lack of healthcare?
Yeah, and Steve, I don't want anybody to think that I'm being a Pollyanna when I'm saying this, but I want to tell you that in my world, I have been relieved to see the amount of quick change that the Department of Social Services, which is the agency I'm the most familiar with, and on the federal level, CMS, we've seen some remarkable changes that took place like that, took place on a dime. Let me give you a couple of examples. There are lengthy, I'm saying complicated, prior authorization processes for elders and individuals with disabilities to be able to access certain kinds of services. So there's all this paperwork and it has to go to this level to get approved and that level to get approved and so forth, and you're waiting forever. On a dime, that was completely eliminated because of COVID-19. One of my personal favorite examples is that in order for an older adult to be eligible for community care services through the Connecticut Home Care Program, there is an assessment that has to be completed. It's a face-to-face assessment. The care manager has to sit in front of the client and complete the assessment. Overnight, that face-to-face requirement was completely eliminated, and we were able to rapidly get people who were leaving the acute care hospital. See, we were trying to avoid having people to have to go to a skilled nursing facility if possible. We were trying to disrupt that stream and have them come right home. So being able to do that kind of assessment telephonically basically made all of the difference in the world. So again, those are just two quick examples. And again, I don't want to sound like I'm being naive, but at the federal level, the feds opened the door to allow those things to happen. And then the states or Connecticut responded in kind. It's going to be very interesting moving forward to see where this all goes, because we've learned a tremendous amount as a result of these changes.
Thank you so much, Molly. Dr. Powell, Molly reminds me, confronted with gaps in opportunity to learn literacy to read by third grade. When we talked about employability and finding sustainable work for people to be lifted out of poverty, we were often met with, well, it's too expensive, it's too difficult, it's too complicated. There is an interplay between federal and local law that makes this untenable. All of the reasons that it seems in the last couple of months have simply evaporated because the political will to help in time of pandemic is there. Where was the political will before?
Right.
So that's a trick question, right? But I'll answer it anyway. So let me just say this, and I appreciate Molly lifting up those examples of rapid systems change, because what it highlights for me is that where there is political will, there is a legislative way, right? So if my people who are called by my name, as my mother would say in scripture, would humble themselves and make the changes, we can have the changes, right? So, and we can do them rapidly. And that reminds me that, we've been wrapped up in sort of this myth of complexity, even when it comes to resolving structural racism. We present it as if it is unsolvable, when in fact, we're mapping the human genome. We've sent people to space. We're now rapidly developing vaccines. We can end racism, structural racism, because racism or race is a sociological byproduct of sociological imagination. It doesn't have any real sort of attachment to fact, right? There's more variability between within races than there are between. So so that should say to us that we can fix this. So the political will before, and I still would argue now, has always been slightly slanted towards those who have more economic means and who operate in whiteness, who actually sort of can move about the world as someone who wears white skin. And that is not an indictment. That's not a gotcha. That's just a fact. And I think if we're going to deal with it, we have to address that. And here's the thing: when you were talking earlier about, how does this connect to health equity, this conversation we're having, it deeply connects to health equity, because if we look at the history, books like Medical Apartheid, Bones in the Basement, Working Cures, numerous documents that are actually laying out for us a clear history of medical malice committed against communities of color largely against Black and brown bodies, to be precise. We know that these kinds of practices have been embedded in the structures of health system processes, and in the decision-making around the allocation of resources. So race has always been in the picture. Racial justice issues have always been at the center of health equity issues, because again, power, privilege, and bodily autonomy are all tied to who has the say and who makes the decisions. So even during slavery times, when people were enslaved, those enslaved people weren't making decisions about when they saw the doctor and what medicines they could take. There were people who were owning responsibility over those decisions. That has implications for how Black and brown people interface with health systems and the trust they bestow unto them. And we know that mistrust in health systems is rational and rooted in real and actual instances of mistreatment. So when we look at communities of color and we say, well, we're building the testing, why aren't they coming? They aren't coming because we have not actually done the work to restore trust. Trust thickens and thins with cumulative interactions with systems. It's not immutable. So I think that we have to ask ourselves about, when we ask questions like, where is the political will? That question needs to be directed, I think, more appropriately. And I know you're doing it here for the purposes of having the conversation, but to those who actually hold most of the power over the decisions. Where is the political will around creating a truly equitable state, nation, local, a city? Where are those, where is the will around that? And I think that is a question that's looming at the center. It's the elephant in the room of many of the rooms that we enter when we're trying to push systems and people to make decisions that will truly benefit the vulnerable in our communities.
Thank you, Dr. Powell. Senator Winfield, what's compelling in this discussion about racism is that not once have I heard a partisan remark, because it's very clear that racism is nonpartisan. Can you talk a little bit about the nature of racism in a political system and how it is that it impacts across the board the decisions that are made that ultimately impact people of color and the poor?
Ubiquitous. I think that we see it in every aspect of what we do in the political sphere. And similar to what we were saying earlier about the need for certain voices to prevail, particularly when you're having a conversation about the issues of the people whose voices we will be talking about in the political sphere. You're okay to say whatever until you touch on anything that gets close to racism. The minute you start talking about things, whether you say the word or not, all of a sudden things change. And so when we're having a conversation about healthcare, you're fine to talk about it in a blind way. right? You're fine to talk about your desire to see us have a better system of maybe universal health care or whatever the case may be. But if you start adding in that the social determinants that we've been talking about in these conversations are important, and what that system looks like and how it's designed must address those social determinants because racism, then the conversation becomes a completely different conversation. And if you speak about it too much, there are ways that people attempt to marginalize you and make you sound like you don't know what you're talking about. I brought up the example, again, this is not directly what we're talking about, but I brought up the example of a couple of years ago having a conversation about what was going on with police and talking about my experience and being told right there on camera in front of everybody, and the person did not realize how they were playing right into racism about the experience of the white man who was about 70 years old and why couldn't Black people simply do what he did, right? Well, there are reasons why we can't do what he did. Not that we should ever have to, but there are reasons we can't do it. And those are the structural reasons. And if you ask this man, he would not think of himself as racist. He wouldn't think of himself as someone who held up a racist system, and yet he was, right? And so in these conversations, you are watching people who don't think of themselves as racist. They may not be, but that doesn't matter. What matters ultimately is whether or not you're holding up the racist system, and you can do that without being a racist because you're blind to the fact that the whole system is racist. And if you endeavor to do things to guard the system and not guard people, you are in fact holding up a racist system, and you are just as bad for Black people and people of color as someone who is racist.
More on that in a bit, Senator Winfield. Dr. Powell, you had another example.
Yeah, so I wanted to just sort of acknowledge too that, while we're talking about this issue around racism so passionately tonight, that we're doing that because we've just lost some, members of the village, right, to racialized violence. So it is impossible to have a conversation like this today, on this day, without allowing that to naturally seep in. And quite frankly, it's refreshing because we shouldn't be having conversations in a vacuum that are tone deaf to issues that are happening right in front of us. And then as an example of, how this plays out with respect to COVID-19 and disproportionate risk, I think we have to think about how racism creeps into the decision-making as we're making choices, right, or selections for populations that we're serving based on limited information. For example, how do we decide who gets a ventilator and who doesn't when implicit bias is operating all around us? How do we decide who gets tested and who doesn't when testing resources are scarce? How do we decide who has to go into work and who gets the privilege of staying home while being supported economically? All of those decisions have implications for equity. And when equity isn't centered in our decision-making, then we end up making choices for populations that actually further entrench or, the disparities or the divide. And so it is critical that this isn't a spurious conversation we're having, because data shows, experience shows that racism that is operating around us in our daily lives gets translated over. Everyone should read Unequal Treatment, if you haven't, produced by the National Academies years ago, but it still rings true today. And so I think that we have to ask these tough questions and have these conversations because it matters. It's a life or death situation. For many people who are standing at the cliff and hoping that they'll get equitable care and are being turned away, or who are watching their families perish, this is serious business. And so for any listener who may think this conversation shouldn't be about racism, we invite you to check some resources that we'll provide. And I'm happy to send those your way, Steve, for audience members. But it's important that we lift this up and we do so in a manner that respects human life, the life that's being lost in the midst of this pandemic, and the lives that we can save if we make the right decisions.
Thank you, Dr. Powell. For the benefit of our viewers, today the Commission is hosting Universal Exposure, Disproportionate Impact, the Imperative of an Equity Response to Pandemic and Healthcare. Dr. Everett, what happens to equity deferred? There's a real question here about if we are not having these conversations intentionally and with purpose, it is a foundational threat to our democracy. What happens to equity deferred?
The loss of lives that we did not need to lose during this pandemic, the loss of economic prosperity and ability to live. We are not an independent, nominal society where any one of us does not need the other to make it and to survive. And I think that's just we can have this conversation at its altruistic level, that we are all humans and that we all deserve the right to breathe, to live, to have a home, to have shelter, all of those things. But if we want to be selfish, let's be selfish and talk about what the pandemic has shown us is the definition of who's essential is really not who we once thought it was. So equity deferred says we can't, if we are not building our systems to take care of those who are taking care of us, then who's going to do it? Who is going to be our retail worker? The retail worker that I engage with every single time I go to the store is a person of color. Who's going to be the nurse at the nursing home who's taking care of your parents when they're in a nursing home? My mother was a certified nursing assistant. When my father was in a rehab facility, every single individual who took care of him in a largely white institution were Black and brown individuals. We are losing the ability to live at our highest and best selves in our United States of America because we are not promoting the very basic foundational principle of equity. We did not all start at the same space. We do not all start at the same place. Each of us needs something different to get to our highest and optimal best self. And we need to be a society that provides that. It's something that is just really clear. And if those who are listening don't know the language about that equity deferred, read Langston Hughes' The Dream Deferred. It explains to you completely what we are living now and what we will continue to live if we do not address the fundamental fact that we are not given all of the things, we are not provided all of the opportunities equally, equitably, fairly to get to our best selves. And that is harming all of us from getting to our best selves, not just one person. And if I can throw out a tool, a resource for you, when we are evaluating this pandemic and when we're thinking about what would equity tangibly look like, rather than a principle of universalism, to resolve this, look at John Powell's conversation around targeted universalism, where you build your systems based on the least of us in the system who are faring the least, who are probably going to be left out if we don't otherwise focus squarely and completely upon them, and build a system that takes care of those individuals and those communities within there, and that will work for everyone. To be a resilient state, to be an economically booming state, to be a thriving state, to be a state that can attract individuals to the state and keep us here, equity has to be at the forefront.
Thank you, Dr. Everett. You know, there are some really compelling discussions, and recently there has been some stretching in the state in terms of inviting more diversity of voices to the conversations about recovery, what recovery really looks like in the context of pandemic. I think one of the things that you and I have wondered aloud about is, does recovery mean getting back to the way things were? And Senator Winfield, are you comfortable with recovering to the way things were?
No. Why would I want to go back to that? That's a system that made this happen the way that it's happened, right? So I think recovery, if we're actually going to recover for all communities, has to absolutely be different. I think we have to have legal and policy responses to those social determinants. I think that interventions, like we've been talking about social distancing and other things, right? Well, again, you have to have social and legal structures that allow for that to happen and people to feel safe that they can do those things, right? So there's a response that has to happen in order for us to move forward. If we simply recover, all that we've done is to not only leave in place the structures that existed, but as I've said on several of these calls, further concretize them, make them harder, make them more difficult to overcome, because there's a gap that has been created by the response we have between communities that are being responded to in ways that are useful, helpful, and communities that are not. And by that, I mean particularly Black communities and communities of color. So no, I do not think that recovery is good enough. I do not think that if we don't take the things that we're talking about in this conversation and continue to have the conversations about them, build them into policy and law, that we've done anything other than to help boost up the system that we've always boosted up, and that system is racist and should not exist in the way that it does.
Senator, thank you. You know, the work of this commission is work that is rooted in both equity and opportunity. And some of what you are describing is the opportunity for us to reframe and really rebuild some of the ways in which we address not only the needs, but the opportunities of all of the people in the state. And part of that rebuilding, from what I'm hearing from each of you, is a real truth-telling about the root cause, as you describe it. And Connecticut is not immune to it. You know, oftentimes we are eager to look south when we want to find examples of institutional racism, when we want to find examples of a fraught history between people of color and the people who brought them here. But as we learned in some of our earlier discussions last year about the 1619 Project, those roots are deep in New England and deep in the state of Connecticut. So I appreciate the opportunity not only to recover, but also to re-examine some of the institutions that are built on that history. So thank you for that. Molly, you know, when I think about some of what you were describing, the way that we were able to turn on a dime, if you were able to make a wish and it could come true, what are some of the things that you would keep about the new way of doing things that have removed some of those barriers to help families like Mary?
I have a couple of thoughts about that, Steve. One is that one of the most disturbing things, and I'm sure your audience has heard this over and over, about the lives lost because of the pandemic is the extremely disproportionate number of people who are, quote, older adults. And we've all seen the statistics. I think I saw last night, 87% of the deaths in the United States so far are people over the age of 60. So I think we've got this funny situation in which we have to be very cautious that we don't start to do things that disempower elders of color by virtue of age. We have enough challenges. But I hear more and more about older people are scared. So we're going to have the food stores open at 6 o'clock in the morning so that elders can go to the food store at 6 o'clock in the morning. That this idea of fear associated with the pandemic is very disempowering for people. So I think we have to find the right blend between acknowledging the fact that elders have disproportionately suffered more, and commensurate with that, being sure that we're not taking away people's voice, that we're letting people know that we know that they know what's best for them and that they know what they need. So for me, it would be some of the things that I already mentioned. I would like to see there be more flexibility in a lot of government regulations that allow for thinking out of the box and different ways of trying to do things. And I think it's very important, as I said, that we be very careful about the new normal of how we perceive older adults and their wisdom and their ability to think for themselves and their ability to determine what is important to them.
Thank you for that, Molly. I'm reminded of some of the data, the initial data that's coming out of where it is that some of our seniors have passed, what the demographics were there, and I'm reminded of the disproportionality of those numbers when it comes to seniors of color, specifically poor seniors of color. Mm-hmm. So, you know, I know that story is a developing story. I know that there are many who are interested in looking further into what exactly it is that happened. But, you know, to your mind, Dr. Powell, what is at play when so many of our, you know, so many of our seniors ultimately do end up on Title 19, but yet Title 19 recipients in one community may have very different outcomes than Title 19 recipients in other communities. What is the disparity there? What's happening in our nursing homes?
Well, I mean, as we've been pointing out throughout this conversation, largely what we're observing in terms of health outcomes, the differences are really attributable to differences in access to resources, differences in access to opportunity. So this really compelling story that Molly told about Mary is an all too familiar one, right? Where you have an elder person of color with low economic resources or income or no income, living in situations where they can't get to the things they need to maintain or sustain a level of good health. And what's been troubling to me, Molly, when you're talking, I was having this conversation with a couple of my sisters about this sense that elders are expendable somehow, like that, you know, they've lived a long enough life and therefore, you know, why should we worry that more of our elders are impacted? And as a woman of color who grew up in the South and has deep intergenerational ties, both here and then on the continent, I was so like disturbed by that because I was trying to imagine a world without wisdom in it. No pun intended, but a world without our elders, right? Like what would that look like? And for the intergenerational transmission of knowledge, culture, values, humility, grace, all of that would be exercised out of our society if we were just to assume that let's let the elders, you know, they've lived their life and let's not worry about them. That's troubling to me. And that narrative that was emerging in the beginning of the pandemic was really problematic. So I'm glad you lifted it up. I do want to say, Steve, something about you know, resilience as it relates to elders and community, and particularly in communities of color. You know, I'm a positive psychologist, so I think I'm a radical optimist, so I always think the best about people to my own detriment sometimes, but I always want to believe that everyone has good intentions. And so people of color are the poster children for resilience. There's nothing, you know, more resilient than living in a country that blatantly disregards your humanity, and you still vote, you engage civically, you have children, raise families, you pay your taxes. That's resilience, an exemplar of resilience. But what we often miss in the resilience narrative is the hits that people are taking. What I remind people is that resilience doesn't mean you're some superhuman person. It means you've taken a hit first and you've managed to muster either the collective resources, intergenerationally and otherwise, to restore yourself. But it doesn't discount the hit. And so I find it sometimes problematic, and not in this conversation, but in others I've been in, when people are like, let's just build resilience in individuals, as if environments don't constrain choice, as if environments don't constrain resilience, and as if people haven't actually taken a substantial and collective hit. So I say deal with the hit first, and then we can talk about the bounce back.
It's amazing. Thank you for that. And Dr. Everett and I participated in a conversation just a few days ago. And the invitation was one where we were to hear the Boston, a representative from a federal organization, I'll say, talking about resilience. And I think we went into that conversation really expecting to hear really a discussion about the deficits that need to be addressed in individuals of color and the poor and building resilience for them. But what was interesting is that it wasn't that at all. What they talked about is exactly what you're talking about, which is there is actually the resilience that they refer to is the lack of resilience in a society that marginalizes an entire section of its population. And it gave the example of a very famous building that was one of the only buildings in town that really provided for itself before a flood, and just surrounded itself with everything it needed to do to remain operational post-flood. The entire city was devastated. It was the only building left standing with lights on. And because it was the only building, you couldn't get to it, you couldn't get out of it, and it was completely an island of uselessness unto itself. And that is really what we're seeing now as a narrative in the state of Connecticut, because of the fact that so many of our infrastructures are broken. And so many of the people that we are claiming to serve are really not served by the policies in place and the budgets in place. really it's the resilience of the state that is in peril. So what do we do, Senator Winfield? How do we, in the context of your leadership as a senator and in the context of leadership more generally, how do we buttress the resilience of this state by buttressing the opportunity for the people that have been historically and to this date marginalized?
Well, I mean, just ask an easy question. That is a difficult question, and I'm not probably going to do a great job of answering that one. But let me talk about this issue of resilience, right? So, during Dr. Powell's comments where she brought that up, she talked about how these communities go on to do certain things. They go on to vote. They go on to raise families. I will tell you that I've always wanted to have children, but I didn't have children, right? So there was actually a kind of sense of relief that I didn't have those children after I got over the fact that I wasn't having them. And then when I had children, there's a stress that is induced in me because I have children, because I understand what it is to be Black and have children in this country. And one of the things that goes back to the conversation we're having about health is what happens to people because of the fact that they have to experience all of these things. What happens to communities that have the relationship to cortisol that our communities have, right? Like something that people don't talk about and what that does to the body. And about community level stress and community level trauma, which is something that, in the last decade or so, people talk about more than they ever talked about before. They didn't even really talk about it before. But if you ask any of us, we could have explained community level trauma because we exist inside of this, right? And so I think what we have to do is what we're doing right here, is have these conversations in a way that goes beyond having a conversation inside of the circle, goes to the point where you're having the people who have the ability to have that conversation and unfortunately have certain things in place so that people might listen to them, so that people can recognize what it is we're talking about, what the real impact is, right? So that when we talk about trauma, we're not just talking about individual trauma. We're not just talking about a one-off trauma. We're talking about community level and complex traumas, right? We're talking about things that other people don't experience in the same way. And it's okay that they don't, but it is important that when we speak, we are heard because we are bringing to the conversation something different. I just want to touch on one other thing about Connecticut and racism, because I think we are often allowed to suggest that we are different, right? Stephen, you talked about looking south. But when I look internally and I think about voting, I think about how when we have the conversation about voting, the conversation begins with the reasons why we shouldn't vote. And it's not just because there's going to be fraud, right? It's because certain communities will attempt that fraud, right? And those are communities of color. When I think about the social determinants that bring us to this place, right? Connecticut has a history of redlining like any other community, and we don't do that anymore. But very recently, we had a battle over 830G and housing, right? When I think about all of the things that we talk about in other places, when I think about prisons currently in this pandemic, the state's response to the prison system is to allow people to stay where they are, largely, and to, if anything we're doing, to ramp up what we've already been doing. That is not a response. And when you look at the disproportionate number of people in the system who are Black and people of color, you have to ask yourself, why is this allowed? Why do we do what we do? And so I don't want us to walk around with the assumption that we're better than other places. We do it differently, but we are no better. Racism has an impact in the state of Connecticut. And because we have told ourselves the story that it does not, we are doing complete damage to these communities. And that is something we must wrestle with and say out loud and say for everyone to know.
Thank you. Dr. Everett, I'm going to come back to you in a second to ask you a question about systems and perspective, but I know, Dr. Powell, you had a yes hand.
Yes, and I want to underscore the conversation around trauma, because that is an area that is near and dear to my heart for all reasons I wished it weren't. And not the least of which is in treating individuals who have been exposed to trauma or traumatizing situations. And I can tell you that there is a buttressing literature on racial trauma and trauma specific to experiences of racism that are worth, sort of lifting up here. But I also want to remind us that the pandemic itself can be a traumatizing event. which can compound existing trauma in communities. And when you can have that trauma sort of there, lodged in your spirit, brain, and body, and then you turn on the television and you see the repeated, cycle of Black and brown people being subjected to racialized violence during the pandemic, you also can experience vicarious trauma, which has an equally impactful, hit, imposes a hit on your body, mind, and spirit in a similar way. And so while we're talking about disproportionate risk, we need to think about what are the compounded mental and behavioral health issues that are emerging as a consequence of both the trauma that is imposed by COVID-19 and the traumas that are occurring in everyday life and that have been with people for a long time, the intergenerational traumas. These have implications for systems trust, that issue of like, if we build a contact tracing, protocol, will people come to it? Will they feel comfortable and safe? And also, how will we deal with the fallout on the mental and behavioral health side as a result of this, as people are sort of reemerging into social space after, weeks and weeks of isolation with all kinds of things happening in homes that we are not, privy to, but we know by data are happening, like increases in domestic and interpersonal violence, increases in child abuse and neglect, all of those issues which disproportionately affect communities that have low resources. So again, all of these issues around the intermingling of these issues, the thorniness of it, this wicked problem that's before us need to be lifted up. And while it seems complicated, it can be perceived that way. There are some clear opportunities for us to make a difference. We can start co-locating services in communities of vulnerable communities where people can get one-stop shopping, sorts of attention for testing, PPE, and mental health or primary care. We can embed some of these protocols into telehealth, protocols so that we're asking people about both their regular traumas and experiences, but trauma related to COVID-19. We can create mental health first aid that is deployed specifically to communities of color and employ individuals from those neighborhoods and communities as lay health advisors and create a pipeline to economic, opportunity or employment opportunities. So there are ways that we can fix this. Again, if we pay attention to the fallout, particularly the mental and behavioral health fallout, which is particularly concerning to me, as we look at the data around suicide risk and disproportionate upticks in suicide, particularly among Black boys and Black girls. I mean, there are many, many ways that this issue that we're talking about is also connected to mental health, behavioral health, and trauma-related issues. And if we don't use both a trauma-informed and a healing-centered lens, that we're going to miss important opportunities to make a difference.
Thank you, Dr. Powell. For the benefit of our listeners on Facebook Live and on CTN, this is our virtual town hall meeting of the Commission, Universal Exposure, Disproportionate Impact, the Imperative of an Equity Response to Pandemic and Healthcare. Dr. Everett, often there's a lot of framing that's happening in this discussion. And I know that everyone among us, I think, sees our communities as a collection of assets and human assets, more specifically. There are well-meaning elements in every conversation of human service that would look at an urban center and think, wouldn't there be better opportunity if the urban center were dispersed in some way, if poverty was decentralized, if somehow people living in these urban centers could find opportunity elsewhere. We have had discussions about that before. When I look at communities, I see something very different. Dr. Everett, what do you see when you look into communities that are distressed?
When I look at communities that are distressed, what I see is a historical disinvestment in communities that have no longer served the benefit or the need of whatever that state or society needed at that time. So when we talk about when Senator Winfield mentioned earlier redlining and not necessarily acting underneath the guise of redlining actively now, we still are living the repercussions of redlining. And what I mean by that is when we have made a decision as a society, as a state, as a locality, to concentrate poverty or to concentrate a grouping of people, and then follow suit with that our economic investments, our community investments, or the lack thereof, then we are getting what the system was designed to give us. We are getting urban centers that are not rich in what they need to thrive and survive. So the conversation about moving people from that center, the place where they have chosen to live because that might be the only choice, or chosen to live because historically, generationally, that's where their family has been, or chosen to live because that's where they actually have made an active decision to be, and say, hey, why don't we relocate you from there and put you into the suburbs? What we have seen in history is going to happen is suburbia then moves to the city, and the city then gets the investments that it should have had all the time. We need to stop this cycle of moving people or displacing people and start the cycle of investing rightly in communities to provide them the things and tools and resources that they need to survive where they are. There are plenty of examples of gentrification. I don't have enough examples of reinvestment and redevelopment and building and making it clear that we are going to redesign our educational funding. We are going to redesign our community investment. We are going to redesign our economic incentives that we provide to businesses to locate into these concentrated poverty pockets and build a system of economic survival where people can live, work, and play right where they have been all the time. I see a community of people who have been resilient despite the odds, who are living together and finding mutual aid together. But I'm finding governments and private industry that are not providing them the same mutual aid, the same aid, and providing the same resources necessary to live there. I don't know that we need to have an either or conversation. It can be a both and. But for me, if we start the conversation as displacement of people and bodies and communities and disrupting networks that have been built and systems that they have built on top of the system, that I have a problem with that. It just doesn't sit well with me because we know what the result then, we know what comes after that. We know what the results of that will look like.
Thank you, Dr. Everett. Senator Winfield, when we think about some of the policies that are aimed at really improving communities, it seems to me that most of those policies are aimed at figuring out a way to bring economic opportunity to a community rather than finding economic opportunity within a community, with the participants being the people who live there so that they may thrive there. And I also think about investments. Dr. Everett, you mentioned some of the investments that we should be doing in our communities. I think about the prevalence of lead and lead paint in the old and aging infrastructures. I think about the lack of green space, which causes temperatures to be higher in urban centers, thereby exacerbating dust and asthma. I think about all of the disparate health impacts felt and experienced by people of color because of the lack of investment and the lack of seeing people of color who live in these communities as assets within their own communities. Senator Winfield, how do we push these investments?
Yeah, I want to call your attention to, recently there was the Transportation and Climate Initiative, I think some people know about. And what the Transportation and Climate Initiative ostensibly was supposed to be talking about are these very issues. I happened to get wind that they were doing these different discussions in different parts of basically the Eastern Seaboard with the states. And one of them was here at Yale. So I happened to get wind of it. Nobody told me. It was right down the block from where I live in my district. And so I showed up, right? And they put me on the panel because they're like, oh, he's here. And when I showed up, I was like, how in the world are you talking about this? Talking about what's going on in these communities. And when I walk in, I'm the black I represent all the black people in the country, basically. That's impossible to me. And you're a couple of blocks down from where the people you're talking about live, but none of them know this is going on. And that had a shift. It actually, strangely enough, had a shift in the conversation going forward that piggybacked on some work that some people in the space looking for equity in that kind of transportation and climate space we're working on. why I bring that up is I think the Transportation and Climate Initiative was important, but the state of Connecticut pulled out of TCI, and the state of Connecticut pulled out of TCI because it was difficult to talk to people about doing things differently, right? It was difficult to talk to people about doing things differently for the communities we were talking about. We're talking about everybody, but there was a lens that was looking at the different levels of particulate in Black and Brown communities, that we're talking about green space and what happens there. We're talking about what the impacts are in these communities, and it was becoming more and more explicit. And at the very moment when it was becoming more and more explicit and we should be holding it up, this state's government, and the legislature wasn't really involved at that point, but this state's government decided we can't do this because business doesn't like it, right? And so I think what we have to do is, one, know that these things are happening, because I think largely people in our communities didn't know it was happening, but two, provide the avenues by which people know they're happening so that there can be more voice added to the conversation. And that's one of the things we haven't done. That's one of the reasons why we're doing this very thing. Because if we're looking to other people's models, other people's media, then we're not going to be able to do this. We have to create the space for ourselves so that people can hear it, people can be informed, and we can bring them into the conversation. I think that's the kind of thing that we need to be working on.
Thank you, Senator Winfield. You know, I think laced, threaded throughout our conversation isn't only the imperative of what we need to do, but also the imperative of what we need to undo. And some of that undoing is undoing the steady habits with which we have led, the steady habits with which we have coexisted, and really think boldly about what it means to address systemic racism, systemic inequities, and ultimately systemic inequality and opportunity. Dr. Powell, as we start to wrap up our conversation for tonight, a conversation that, as Senator Winfield knows, is a continuing conversation, I'd really love to hear from you as a fellow optimist in the room. You know, where would you like to see us after this pandemic when it comes to health equity and other equity?
Well, first of all, I'd like to see us better off than when we arrived here, for sure. And I think that at this particular moment, the way forward for us is to think critically about and to ask ourselves whenever we're at a table, first of all, who isn't here that should be? Mm-hmm. That's the most important question you can ask. And have we expanded this table, not just in terms of representation, right? Because every person of color who's a leader has been a beard, window dressing, or jazz hands. We've all been there. And it's not a comfortable feeling. Something that the senator alluded to, like being the only brown person, Black person, woman at the table is not a comfortable situation to be in. And we can do something about that. So we have an opportunity now to infiltrate our systems and structures with bold thinkers, to invite community to the table in a real way, to incentivize them for being there, right? To not think just because community are available that we should be pulling on them to come to tables and have discussions and give us the same insights they've given us at every town hall they've attended and we haven't acted on. We have to be ready and poised to move on the ground truth solutions that are presented to us. And most importantly, we have to not just hope for, but demand that equity be at the center. That we have to demand that. And as leaders at tables, we have some leverage, right? We have an opportunity to set those agendas and to do some priority setting. What I would also like to see us do more of in the spirit of equity and inclusion is to have more strategy alignment. I've been at many tables where one leader hasn't talked to the other, where one system's doing something and another's doing something. And not only does that lead to duplication of effort and unnecessary energy expenditure, it also leads to really sustained mistakes and impactful mistakes and harms to community. So I'd like us to rise together and to take more of a collective impact approach, to move towards a regional approach or a county level approach. And I know that's bold in the state of Connecticut, but as the newest, member of the Connecticut community, I can say that probably a little bit bolder than most. But I think that is the way forward towards aligning strategy and creating, solutions that we can build on and sustain over time. Without that kind of approach, we run the risk of splintering our efforts, and more importantly, of like ending up in the same river twice.
Thank you, Dr. Powell. Molly, what would the world be like 5 years from now if Dr. Powell's advice were taken? For the people that you serve more specifically.
Yeah, that's a beautiful thought. I simply can't stress strongly enough how much we need to bring the right players together to make this happen. And I don't know if that means creating new entities or bolstering existing entities in order to create the fire, to create the dynamic to make this kind of change happen. I mean, there's pockets of passion and pockets of interest and groups working on this and church groups working on that. But that kind of synergy of bringing us all, to Wisdom's point, to the same table, that we're all at the same table, we haven't cracked the nut on that yet. And certainly, I think that all of the issues that have to do with healthcare, where there are such tremendous disparities, and we didn't have time in this conversation, and it probably wasn't necessary to talk about the issues associated with life expectancy, or to talk about the hospitalization issues and what happens if you're a black man versus anybody else and you end up in the hospital. We didn't have a chance to talk about any of that. That all has an impact on the elder population that, I am passionately involved in working with. So I would say that if wisdom's wisdom could happen, it would be that we would be working together in a collaborative, synergistic way, that where we would be able to reduce those health outcome issues for our elder individuals of color.
Thank you, Molly. Dr. Everett, similar question to you. What would be the first thing that you would get rid of?
I think you're starting me at the beginning of you're starting me back where I began in racism. But let me be more specific in saying, as the resident realist, I think that we need to start the conversation with asking the right questions, and a set of questions over and over again. I appreciate and love what Wisdom said about who's not at the table, who's not in the room. Are we taxing any one individual in this space to be the representative for all individuals who look like, live like, see, or are similarly situated as this person? I think understanding and asking ourselves, what privilege do I have? And how am I effectively utilizing that privilege for the betterment of other people and the destruction of privilege generally? These are just basic things that we can each day ask ourselves that start to dismantle the system of privilege that we have here. The last thing I'll say, and this is probably a shout out to my team who's watching, because since I said it, they always ask me to say it every single time. The final part is to remember that in every solution we're building, we are all a product of colonization. And colonized minds build colonized solutions to colonized problems. And we have to break that cycle. We have to consistently be confident. Again, now this is the resident realist saying this. We have to be confident that there's a world we can build that we've never seen, that there's a space that we can live that we've never lived in, where we are kinder to each other, where we respect and revere our elders, where people live long regardless of their race, and that there are not other social, demographic issues that take lives before they are necessary. I'm confident that that's a space we can get to if we just wake up every morning reminding ourselves to ask these fundamental questions and to focus on this fundamental truth that we are all human beings who have been brought to this space to live and cohesively be together. And if we strive towards that vision, that world, we can get rid of all of these inequities we see in health, in education, in criminal justice, in all of these spaces.
Thank you, Dr. Everett. You know, from this optimist to you, I think that we agree that the very first thing that we have to get rid of is that often untouchable notion of the way things are and our quiet acquiescence to the way things are. So thank you for that. Senator Winfield, I'm going to kind of leave this with you, and I'm going to ask you a slightly different question and put you on the spot a little bit. You know, with the benefit of hindsight, and I know that things are changing every day, what would you do differently 3 months ago?
Well, I would have centered the voices of the people that we knew were going to have that disparate impact. And I wouldn't have put them in places where they could be used to demonstrate anything. I would put them in places where they could actually have some say in the actual policies that we have. That's what I would have done. And let me be clear about what I mean by that. Oftentimes we have all of these panels and groups that are part of the public response, right? A lot of that is to do some work, but a lot of that is actually for show. But then there's usually a much smaller group that gets to make decisions. And that's where you don't normally see the people who we're talking about. That's where I would put them, because I think, and I've said this before, I think at the point where we do that weighing about whose lives are important, about which things we're going to do, you have to have those voices present. If you don't have those voices present, all that other stuff doesn't matter, because any of it can fall by the wayside when the decisions are being made. And I think that's the critical point. And so I'll leave that there. And I know better than say too much after Dr. Everett and Dr. Powell, because they're very powerful. Let me just say one more thing, Stephen. If you're watching this live, tomorrow, the Black and Puerto Rican Caucus has been doing its series of discussions, and they have the governor tomorrow. And we are looking to engage with the governor and ask him the questions that he has not been asked in public necessarily. And so I would encourage people to tune in. That starts at 5:30, I believe, as well. And I think it's important for people to be a part of that discussion. And again, thank you to the commission for the work they've done to help hold up these conversations.
Thank you, Senator. Molly, Dr. Powell, Dr. Everett, Senator Winfield, on behalf of the people that we all serve and represent, I really want to thank you for this frank, honest, bold discussion. I know that it is, as I said, a developing story and a continuing conversation. But I really want to thank you for continuing to push. The needle may not move as easily as we'd like, but we have to keep pushing. Otherwise, none of this matters. So thank you so much for all that you do. And I look forward to our next conversation. Thank you.
Thank you.